Hi, students. I'm going to start off by going through your last exam, and I really hope that everybody listens to this video from start to finish because I guarantee that it will help you out immensely, and there could be a surprise within the video, not saying when, but that will also help you out. A couple of different things. Okay, my exams, please do not Google for answers. As I went through students' exams, I've noticed that students, a few, were using ICD-9 codes. Well, these codes have been obsolete since 2014. So this tells me that you're not using your code book and you're trying to take a quick, easy, fast way out. It's not going to help you in the long run. Really utilize your coding book and don't try to Google answers. It just lets me know that you are not putting your full potential into this course, and it's just not going to end up well. So once again, do not Google ICD or these answers. Try to do them on your own because first of all, I know what students are coming up with ICD-9 and not ICD-10. So let's get started here. Okay, so question one, we have a sign, which everyone did well. So what else should be coded when reporting findings of alcohol in the blood? We don't care about the blood type. Again, what we care about is the level of alcohol in the blood. The BMI is body mass index. That does not make a difference either. Just so you know, this exam here is from a student last year. Kind of took the student that did the best because it was easier for me to show you on an exam that was already taken. Okay, which of the following is considered a symptom? Okay, which is dizziness. Dizziness is going to be a symptom, and it's in your textbook. So we have hyperhidrosis. This just goes back to a little anatomy, which would be menopause if you look that up at all. So when a patient comes in just for chemotherapy, radiation therapy, the first code that you're going to code is Z51. Z codes can be used as first or additional diagnosis. That is true. So principal diagnosis, a Z code is going to be listed first for chemotherapy, radiation. They will be listed as secondary diagnosis for possibly history of. So we'll get more into those scenarios. Patient has rheumatoid arthritis and anemia. The anemia is integral to the rheumatoid arthritis. This is false. The reason that this is false is because anemia and rheumatoid arthritis really don't have anything to do together. If somebody has them, it doesn't necessarily state that when I have rheumatoid arthritis, I have anemia. Or if I have anemia, I'm going to get rheumatoid arthritis. So they're really two separate different things, and it is not integral. So if you would have both of these, you should code both of them. Question 8. Which of the following code are correct when sequencing injury codes? So when a patient has many injuries, the most severe code is coded first. Okay. You don't code the only severe one, and you don't code them in the order they're found. So if a patient comes in with, let's say, just lacerations, which you're going to have to code, but they have a fracture, let's say a fracture of the femur, that is more severe than your laceration. So that's why you need to list that first and then your laceration codes. So we have a patient who came in with a headache, 3 days, and urination. Would you code both the headache and urination? Yes, you would. As once again, they're really not related to each other. You don't know what's going on yet, so you will code them both. If the patient's medical record states shortness of breath due to asthma? Would you report the shortness of breath? No, because the shortness of breath is integral to the asthma. So, what I'm saying here is that shortness of breath or wheezing, okay, those are signs, symptoms of asthma. They're integral to the asthma. So, you only code the definite diagnosis here, which is asthma. When a substance not used correctly, exactly as prescribed, it is poisoning. And that is true. We'll get more into that poisoning coming up here. Symptom codes are designated as principal diagnosis when a responsible condition has been identified. So this is false. So if you have that responsible condition that is identified, that needs to be the principal diagnosis, not the symptom code. Okay, so this one here, Z codes. Z codes should not be assigned if there's a procedure performed during the encounter. Z codes are only used for secondary. These are all false. You can use these whenever. They can be secondary, they can be first listed. Okay, so these again are all false. And the first one really does make the best sense here. Okay, Mr. Johnson admitted to the hospital with chest and epigastric pain, evaluated by the physician with the diagnosis of rule out myocardial infarction. Keep in mind, this patient is inpatient. Mr. Johnson was then transferred to a larger facility. What am I going to code? Okay, keep in mind, the chest and epigastric pain are signs and symptoms of a myocardial infarction. Since this states, and we are an inpatient, anything stated rule out, you can code. So I can code the myocardial infarction. I cannot code the chest pain and the epigastric pain because they are integral to the MI. The key word is here, they did ruled it out. They just are trying to rule it out. Okay, this one here, abnormal liver function test. They plan on doing a biopsy. So there's no confirmed diagnosis. I'm looking up abnormal. Some of you put down liver. You look up liver, it's going to tell you C condition. Okay, is this a sign, symptom, or abnormal clinical finding or abnormal lab test? It's an abnormal lab test. Okay, so if you go back up in here, abnormal liver function test, that's a lab test. Okay, I'm the doctor now. I'm trying to rule out hyperthyroidism. Doing a thyroid workup. Okay, signs and symptoms, everyone did great. Rule out, everyone did, pretty well on this too. It's just uncertain condition the physician wants to try and eliminate. What two condition symptoms will you code? Nervousness and irritability. Hyperthyroidism. No, they do not have a confirmed diagnosis. They do state an uncertain diagnosis, yes. All right, so before I start the coding aspect, FYI, if you listen through this whole area and tell me one thing that you learned, or actually let's make it two things that you learned after I explain the next questions, I will give you 2 extra credit points. Okay, so I need 2 things in the coding section that you did wrong and you understand why you did wrong and tell me why you did it wrong. And you'll get 2 extra credit points on your exam. Okay, so we have excessive drowsiness due to side effects. Okay, so initial counter. First of all, this is an adverse effect. It's not a poisoning. You're taking everything as prescribed. So the first thing I code is the R40.0, which is the drowsiness, and then I code side effects. So if I go to drugs and put in, make sure I spell it right, So I go over here to adverse effect, T4505. One thing I did notice with everyone, or not everyone, some students, you weren't adding that seventh character, and I did take a half a point off, okay? So it should be T450X5A. I hit the wrong one. All right, so let's go on to the next one. This one here, we have patient comes in the ER. They're in acute respiratory failure. They had 12 beers, and then they took their normal dose of lorazepam. Okay, so since you are on a prescribed medication, you mix it with alcohol, that is a poisoning. Anytime you mix alcohol with a prescribed medication and you have a reaction, that's a poisoning. So with this, I'm going to have two codes, one for the alcohol. It's going to be poisoning, accidental. If I were going to say this person didn't, or I should say unintentional. Just to save time, I'm not going to look these up, but I'm just so you know that you're going to go to the poison, accidental, unintentional, and you're going to code alcohol, the lorazepam, and then lastly comes in your respiratory failure. Remember, adverse effects, whatever's wrong with the patients first, and then your T codes. Okay, so the next one here, we have a person who came in for the hospital outpatient for screening. High risk for breast cancer secondary to family history. So this one here, I'm going to have a screening code and then a history code. Everyone did fairly well on that. Same thing with this artificial fitting. That was done well. This one here, we have abdominal mass with jaundice. Okay, so we code them both. All right, we don't know. One's not integral to the other, so I need both diagnosis codes. Examination code was good. Annual checkup was good. Just the procedure, that one went well. Okay, so severe and recurrent stasis. Okay, so we have a nosebleed, right? Just the diagnosis, it states for here. So that should have just been R04.0. The next one, we have shock from taking penicillin administered correctly. So the diagnosis. So once again, we have the T codes, everything. The biggest thing here I saw a lot of students is missing that seventh character. So try not to, forget that. Okay, inpatient. They came in for right lower quadrant abdominal pain. Rule out acute appendicitis. Since this is inpatient, they're stating that they really think after they ran all the tests, because I'm inpatient, I can code rule out. So I'm coding the acute appendicitis for this one, not the abdominal pain. That's integral, okay? Inpatient. Go through your inpatient, outpatient rules. This is very important on when you can code what, okay? This is going to come back to you throughout all the chapters. Okay, so we have reaction to, again, two different medications. Initial visit, this an adverse effect. So I'm going to code the internal bleeding first, and then my two medications for adverse effect on my drug chart right here. Okay. Patient comes in with cough, probable bronchitis, outpatient. Outpatient, I cannot code probable. I have to code the cough. So what they're saying in outpatient, we don't have enough information yet. Okay, vomiting. This one here, poisoning, we have the vomiting second. Allergic reaction, okay, taken prescribed. So here, once again, adverse effect. H code first, T code second. Overdose. Okay, let's go down here. This one here, this student got it wrong, but this one here is going to be a poisoning. And then what's wrong, the nausea second. Okay, so look through these, and that wraps it up. Email me.